This new law is essentially requiring that the Department of Community Health provide information for athletes, students, coaches, basically everybody involved in concussions in youth sports, so that everybody is up to date on what information is out there. It necessitates that these students are removed from play if they experience anything that could potentially be a concussion. It also mandates that the students see a healthcare provider before they're allowed to return to play. And it's all in the name of safety for these kids.
And I think the important point is that it's really raising the awareness of what a concussion is and the consequences of concussion, both short-term and long-term. And I think more and more we're finding out more and more long-term problems that can occur if an athlete isn't allowed to adequately recover from a concussion. I think that when an athlete is concussed, their brain is injured. The brain isn't working well. And we found a number of things can happen if that brain gets re-injured before it has a chance to recover. There's some short-term things that can happen. Their symptoms can get worse. There's an entity called the second impact syndrome, where if the brain receives another blow before it's recovered, the athlete can undergo a very serious injury and even death if that occurs. But I think more importantly, if that brain's not allowed to recover, those longer-term consequences that can occur, learning difficulties, sleep difficulties, different behavioral things, and even things that can occur very later in life.
It's important because even with all the research that we have up to this point, we don't know everything there is to know about concussions. We don't know all the long-term effects of a concussion. We don't know what the effect of cumulative small or minor blows to the head may cause. I think it's important that these kids are evaluated and treated just again for the safety of the kids. These are kids, they're growing, they're developing. We don't want to have any long-term problems for them or cause any long-term effects in a growing child.
WellSport really has sought to bring together the best available information that we have on concussion using the CDC's Heads Up program and another number of other programs throughout the country, and tried to put them into an organized program, an organized way we in the community can approach concussion. In Midland, we started a program last year where we do a standardized sideline concussion evaluation, which involves reviewing symptoms, putting the athlete through some maneuvers and some physical exam things on the sideline to help detail the exact nature of the injury, and then we can follow those details along as the athlete goes through the recovery period. That's involved community education in various settings, talking with coaches, athletes, parents about the importance of concussion, and laying out a logical approach from the diagnosis of concussion to the medical follow-up concussion to an organized return to play, where we actually put the athlete through a number of stages which gradually challenge the athlete both physically and mentally to know that they truly are recovered, that symptoms don't recur as they get challenged more and more. And if they complete that return to play, we at least feel that for our best available evidence that athlete is ready to return to full competition.
I wanted to get a view of the medical field because that's what I've always wanted to get into, and I thought this class was a big opportunity that I could take.
I was definitely looking forward to the physical therapy the most.
My favorite thing about this program is the community that we've built together.
And it's very realistic and hands-on, and that's how I learn best.
The rehabilitation class explores different careers such as occupational therapy, physical therapy, speech, art, and then we look at the different aspects as far as what they're actually doing and the patient, what physically is happening to the patient, that they're in that therapy as well. So when we're doing physical therapy, we might do things such as walking the steps, practicing which foot comes first, the affected and the non-affected. We do range of motion for PT and OT, occupational therapy. For art therapy, we do finger painting, and they learn how to do groups in art therapy. They have to learn how to give CPR, the compressions and breathing, to an adult and an infant. They also learn choking, how to take care of a choking victim, responsive or unresponsive.
I certainly feel like it puts them ahead, and if they have this college credit and before they go into college, it can open up a lot of doors for them.
We're doing a little bit of athletic taping just to prevent her from overflexion. It's more hands-on experience. You get to learn a lot more. It's not just reading out of a book.
Which I really like, because I don't like to be sitting down at a desk all day just doing work. It's a really good program, and you learn a lot here.
I really like the physical therapy just because that's what I'm thinking of going into, so I think I just kind of had a bias when we started it.
The only one that I didn't know anything about was dance therapy. I had no idea that that was something that could really help people.
My future career goal is, my #1 goal is to become a speech-language pathologist.
I would like to be a physical therapist assistant.
I'm thinking mostly in sports medicine.
Seeing them exploring new skills and careers and seeing their eyes shine as they're like, oh, I like this one, I didn't know about this one, and this is a good fit for me.
Sports medicine, also known as sport and exercise medicine, (SEM), is a branch of medicine that deals with physical fitness and the treatment and prevention of injuries related to sports and exercise. Although most sports teams have employed team physicians for many years, it is only since the late 20th century that sports medicine has emerged as a distinct field of healthcare. Sport and exercise medicine doctors are specialist physicians who have completed medical school, appropriate residency training, and then specialize further in sports medicine or sports and exercise medicine, the preferred term. Specialization in sports medicine may be a doctor's first specialty, as in Australia, Netherlands, Norway, Italy. It may also be a subspecialty or second specialization following a specialization such as physiatry or orthopedic surgery. The various approaches reflect the medical culture in different countries. Specializing in the treatment of athletes and other physically active individuals, sports and exercise medicine physicians have extensive education in musculoskeletal medicine. Some doctors treat injuries such as muscle, ligament, tendon and bone problems, but may also treat chronic illnesses that can affect physical performance, such as asthma and diabetes. Some doctors also advise on managing and preventing injuries. Specialists in SEM diagnose and treat any medical conditions which regular exercisers or sportspersons encounter. The majority of a SEM physician's time is therefore spent treating musculoskeletal injuries. However, other conditions include sports cardiology issues, unexplained underperformance syndrome, exercise-induced asthma, screening for cardiac abnormalities and diabetes in sports. In addition, team physicians working in elite sports often play a role in performance medicine, whereby an athlete's physiology is monitored and aberrations corrected in order to achieve peak physical performance. Some consultants also deliver clinical physical activity interventions, negating the burden of disease directly attributable to physical inactivity and the compelling evidence for the effectiveness of exercise in the primary, secondary and tertiary prevention of disease. The Foresight Report issued by the Government Office for Science, the 17th of October 2007, highlighted the unsustainable health and economic costs of a nation that continues to be largely sedentary. It forecasts that the incremental costs of this inactivity will be $10 billion per year by 2050, and the wider costs to society and businesses $49.9 billion. Physical inactivity inevitably leads to ill health, and it forecasts the cost of paying for this impact will be unsustainable in the future. No existing group of medical specialists is equipped with the skills and training to deal with this challenge. The concept of exercise as health tool or exercise as medicine trademark is becoming increasingly important. Some physicians are able to evaluate medical patients' comorbidities, perform exercise testing, and provide an exercise prescription, together with a motivational program and exercise classes.